Now, in terms of, say, patient questions, you know, and for patients who may have this question because there's now become a delay in these surgeries, is there ever a timeline for patients where maybe they can no longer be candidates for surgery, or does timing not really matter in terms of delaying things?
Well, in terms of the reconstruction,
Yes.
before we move on to that, in terms of the oncological component, that's a good question, and the powers that be made that risk-benefit analysis saying, okay, we can postpone these surgeries at this stage of disease for several months even. So, but that's really not my purview. I'm not an expert in that. In terms of the reconstruction, there are pros and cons to doing reconstruction in different time settings. So, for instance, in the case of a mastectomy or a bilateral mastectomy, there are many benefits to performing an immediate reconstruction. Those include long-term aesthetics because the skin envelope is preserved. If you would perform a mastectomy, a skin sparing or a nipple sparing mastectomy in which the entire breast skin and nipple may be spared if there's no tumor involvement, you're essentially just coring out the breast tissue from the envelope of the breast skin. If you don't replace that with something, the skin could shrink down and scar down to the chest wall. And then releasing that scar can be challenging and may not be as readily released to create a nice supple skin envelope. And if the skin is excised, then you're just short skin and you have to find a way to either regrow that skin or bring skin from another area in order to replace that. The advantages of immediate reconstruction is you preserve that natural skin envelope. The skin remains soft, remains having a natural shape, and that just offers an overall superior aesthetic outcome. And then there's, of course, the advantage of performing a reconstruction in immediate fashion in which the woman would go to sleep, have the mastectomy, and wake up with something that replaced her breast. May look the same, better, always a little bit different, but psychologically there's a huge advantage in performing an immediate reconstruction. Now, that's not to say that delayed reconstruction is not an option. It's absolutely an option. But you're starting off with a slight disadvantage. What we have done in cases that we were planning to do, what we call an autologous tissue reconstruction, or taking the natural tissue reconstruction, taking parts of the patient's body, transferring into the chest. The DIP flap, or the deep flap, is the most common procedure in which one takes tissue from the lower abdomen. Instead of throwing it away like you would with a tummy tuck, you repurpose it and you basically transplant it within that person's own body. You connect blood vessels that used to go to the skin and fat and connected to in the lower abdominal area. You transfer them and connect them to blood vessels in the chest. And then you mold that into a breast shape. Again, that's called a deep flap or natural tissue reconstruction. Now, that's a slightly longer operation than what we call an implant-based reconstruction, or an implant or a reconstruction that involves a tissue expander and then an implant. The natural tissue is a slightly longer operation and slightly longer hospital stay, and definitely requires more resources at the hospital, maybe a bit more follow-up early on after surgery. So cases that we had planned to do that type of reconstruction, we said, okay, what can we still do to minimize length of stay, minimize resources dwindle on the hospital, and then just make everything as concise and fast as we can. So we have switched our natural tissue reconstructions to implant-based reconstructions, frequently as a temporizing measure. So we get to start the reconstruction. We avoid having the skin shrink down because there's nothing filling the breast skin. And then later on, if the patient desires or requires, then we would, once all this clears up, usually not before 3 months from the initial operation, we remove the the implant, the breast implant, or the tissue expander as a placeholder, and then we replace that with the body's own tissue. And that's an excellent way of performing a reconstruction. There are many, many instances where we do that as a planned procedure or set of procedures in pre-COVID days, and I'm sure it'll happen also in post-COVID times. So it's not a total loss if you can't have what maybe goal number one was, because that can be reached later on.
Okay, perfect. Now, for say patients who did get their reconstruction surgery prior to all of this, what's been going on with COVID-19, what's the plan for those patients, and how has the pandemic affected their care plan in any way?
There have been many, many patients that are some way along their reconstructive process. So frequently breast reconstruction will take, sometimes it'll take just one step. Frequently it'll take a couple steps. Every once in a while, there are additional stages that need to be done just to make things just right. Those subsequent steps, now that the cancer is out, are now considered completely elective. They can be really scheduled almost at any time after, I'd say the earliest is a month and a half, but typically we don't do that second step before around 2 months, sometimes even longer. There are benefits to actually waiting and spacing out surgeries for a sort of the system overall to recover. And that includes the tissue that was operated on, the skin, the fat underneath the skin. Everything goes through a healing sequence that just takes time to calm down. So actually, the longer you wait, the better off you are in terms of the palate that you're now working on. If you operate too soon, things may still be swollen. They may not be as supple and easily managed surgically. So the longer you wait, you may actually be better off in terms of your outcome, because it's easier to operate on. You sort of better properties of the tissues to work with. So I wouldn't worry about pushing it off. Tissue expanders that are typically there or designed to be there just temporarily, they can stay in the body for even years. I've seen patients that for one reason or another didn't complete their staged reconstruction with tissue expanders, and they show up years later still with their tissue expander, and that's totally fine. It's not the most comfortable thing in the world. This definitely throws a wrench in life planning, but again, in the risk-benefit balance, there's no problem to wait. Just be safe.